The figures for week 52, that's the last week of the year for COVID and flu, seems to suggest that those COVID and flu numbers are down on that previous week, week 51. Now, this could mean that we've passed the peak of infections for COVID and flu, but it's more likely because of a blip, because of Christmas. And that's what the UKHSA are warning us when we look at these figures, to look at them in context. Although the figures show a slight decline on the previous week, they are still high, but it's more likely because people are, although because of Christmas you're mixing with larger groups, you have family get-togethers, etc., but you're not actually mixing in larger numbers as far as infections are concerned. You're not taking the train or the bus to work, and you're not meeting outside of work, etc., etc., and fewer people might have been testing. So they're urging caution when you look at these figures, but certainly the indicators are for COVID and flu. That's week 52, that's the last week of the year. COVID and flu cases were down, the infections are down on the previous week, that's week 51. And we've also had the numbers published by the ONS, that's the Office for National Statistics. They're giving us an overview of the number of people excess deaths, the number of people who have died over and beyond any given year, why people are dying outside any given setting. Let me go through those numbers with you. They show an increase of on previous years. 14,530 people died in England and Wales in the week to the 23rd of December. That's the highest amount during any week last year. And when we compare that to averages from previous years, it means nearly 2,500 more people died than expected. So that's for the 1 week alone. But over the past 6 months, the total number of excess deaths is over 30,000 in England and Wales. There have been exactly 8,000 deaths due to COVID in that period. And if we exclude those from the total, it means there's been an extra 22,040 deaths not caused by COVID in the past 6 months alone. That's equivalent to 848 a week. Remember too, Sarah Jane, we had that warning from the Royal College of Emergency Medicine that these excess death figures, which are a really good indicator of what's happening with the state of the nation in terms of what we would expect to see in any given year or in any given period with surges in flu and COVID and everything else, how many people are dying beyond that period. And we had the warning from the Royal College of Emergency Medicine that they were suggesting that up to 500 people a week were dying more than they should have been because of the NHS pressures, and that's been disputed by the government and by the NHS, saying that it doesn't think up to 500 more people have died because of those pressures, but that's certainly what the Royal College of Emergency Medicine is telling us. But these figures from the ONS suggesting that we have seen a large increase in the number of excess deaths than we would expect to see according to the yearly averages.